Hey guys, it's Wasif, Pharmacy Dad from Eye Care Pharmacy. So I just wanted to talk to you about the next big shortage we're having and experiencing in pharmacy right now, and that's the shortage in amoxicillin for children. We currently, we're going through a phase where we are getting a lot of sick kids, but it's generally because of the flu, RSV, and COVID. And at the same time, we're seeing a surge in amoxicillin use. On the surface, does not make a whole lot of sense because the flu, RSV, and COVID, they're all caused by viral infections where amoxicillin is an antibiotic. So theoretically, amoxicillin is not going to have any impact on a potential viral infection. So the question is why are we seeing a spike in amoxicillin use at the same time as a spike in viral infections? So there could be a couple of reasons why. One is there's a potential that, there's a higher rate of secondary infections right now, and that's when a viral infection leads to a secondary bacterial infection. So I've seen this in my practice where I've seen someone start off with RSV and they've ended up with pneumonia or sinusitis. In these cases, we did treat them with amoxicillin and they did get better. But this is not like super common, happens in about 4 to 6% of patients. But maybe we're seeing this because we've had mandates kind of lifted broadly. And as a result, we're exposed to more bacteria and viruses at once. So that could be one of the reasons. It's kind of speculation, but that's one of the theories out there. Also, as well, it could be that some physicians are potentially confusing the symptoms of viral infections with bacterial infections, which is super easy to do because you're not really going to know if an infection is viral or bacterial unless you take a swab, send it to a lab, wait 2 or 3 days and see what the results are. I mean, it might not be practical in some cases to do that. So that could be one of the reasons why we're seeing a surge in amoxicillin use. So amoxicillin for adults and kids is used for a variety of infections and usually considered first line for infections such as sinus infections, as well as strep throat, pneumonia, as well as ear infections. So if your child, if you think, they have any one of these conditions and you're going to the physician's office, you should keep in mind that there is a potential that they get prescribed amoxicillin. So if they do, you have to kind of consider, oh, what should I do? What are my next steps? So this is kind of why I'm, what I want to talk about what to do next in this situation. So in some cases, like I think it's probably fairly well known, even by physicians at this point, because usually pharmacists are the first to hear about the shortage, and it kind of trickles down to the physician, which makes sense because we're the ones dispensing the medications. But I think physicians know at this point that there is a shortage in amoxicillin as well. So but if for some reason they don't know, you should just bear in mind, see what they've written for your little one there. And if it's amoxicillin, just ask them, if there are any other uh, alternatives that would be appropriate for your child, because depending upon the type of infection it is or the medical history, they could potentially substitute a different class of antibiotics for the amoxicillin. So that's one of the choices. Another choice is amoxicillin does come in a chewable form. Now, that might be running short soon too. By the time this video is launched and on site, that might be the case that that's short as well. But the amoxicillin chewable comes as a 250 milligram tablet. So depending upon what their weight, if they fall into that sweet spot, they might get away with taking half a tablet or a full tablet of amoxicillin 3 times a day. So that might be a potential option, but you just kind of have to get lucky with what their weight is, if that would be appropriate for them. Also, amoxicillin does come in capsules as a 500 milligrams and a 250. So it might be appropriate for you to potentially open up a capsule of an adult one, because that's not short. There's lots of adult amoxicillin available. So you could take a capsule, open it up, sprinkle it in food and have them ingest it that way. I mean, that's not always practical because sometimes kids are super picky. So, but I mean, if your kid isn't, then that is a potential option. Oh, and as just with Tylenol, and Advil, which is short as well, we can also, potentially compound the amoxicillin formulation for you if that is what's kind of deemed what the best option is. The downside to it, it may take a day for us to be able to make it for you. But that's something else that you could potentially look at. Sometimes, especially specifically for ear infections, sometimes if the kid is comfortable, you could do something called watchful waiting. So watchful waiting is where you wait 48 hours and you see that if if the infection itself improves, meaning your child's immune system just kind of fights it off on its own, which happens in some cases. And if it improves within 48 hours, then you might not need antibiotics at all. So this is called a watchful waiting approach. So depending upon how severe the infection is, this could potentially be a route that you do as well. So typically in this situation, what you do, you take your little one still to the physician. The physician would do the diagnosis. The physician will write you a prescription, but they'll tell you, do not fill this prescription for 48 hours. Let's see how it goes over the next 48 hours. If it gets worse, then potentially you want to go to the pharmacy and fill the prescription. But if it improves, then there's a chance within 48 hours that your kid's immune system ends up fighting it off on its own. And that's the best case scenario where they're able to deal with the viral infection and not take any medication at all. And that's the best we could hope for. So these are some tips that I hope helps you in the shortage for amoxicillin right now. And just wanted to drop another tip here at the end of the video. I know right now Tylenol and Advil is currently short, but the government is going to be supplying us with Tylenol and Advil from like a different country with a different label on it. So we're going to be getting an influx of that at the pharmacy. So if you do, need some Tylenol or Advil that has like the better shelf life on it rather than the ones that we make, that will soon be an option too. So feel free to give us a call at the pharmacy. I'm hoping we're going to have it in the next week or so, just because we have gotten some updates just from the government as well as our wholesaler. Just keep an eye out for it. So it'll be dropping soon. Anyways, thanks for listening, guys. Hope you had a great weekend, and yeah, we'll chat soon. Take care. Bye.